All right, so which condition commonly occurs in military vets and should be a priority? So, what's the most important thing here? What is life and death? Hypertension, meh. This is a chronic issue. It's not going to kill you unless your blood pressure is like 180 over 110. Then you're starting worrying about organ damage, but not really here. Post traumatic stress disorder. I mean, this is definitely something that's seen. People can, this can lead people to hurt themselves, or even hurt others. Hurt others. So we have to be concerned about this, definitely. Hyperlipidemia, this is another chronic issue. This is just bad cholesterol. Change your diet. We can give you a medication for that. Nothing really there. Substance abuse disorder, definitely something that we can be concerned about. But it's not to the point where it's like the post-traumatic stress where this can actually cause them to hurt themselves or hurt others. They may be suffering from alcoholism, maybe using other types of drugs. But at this time, the most pressing issue is the post-traumatic stress disorder. Substance abuse, you typically go to the program. It takes some time. You don't you're not worried that they're going to hurt themselves or hurt others. They are harming themselves, but they're not like cutting themselves. Post-traumatic stress disorder, definitely something we're most concerned about. Hypertension, chronic issue. Hyperlipidemia, chronic issue. Substance abuse disorder, typically something that is chronic, but you just make sure they go to the right program and get the right help. But we're most concerned about the PTSD. What is the most effective method of instructing a specific populations on healthcare information? Printed materials. How many people read? Not a lot, really. Printed, especially, everything's online. Nobody likes to read. Not many people like to read books. And if they do read, maybe they don't understand it. They have to ask questions. Not very effective. Video tutorial. How many video tutorials are there on YouTube? Or you have to watch several of them just to get something done right. Not very effective. It has to be done right. The video has to be catchy, entertaining. Has to be explained in layman's terms. Not everybody will get the video tutorial. Teach back method. So what this is where you teach the patient, and then the patient teaches it back to you. And this way you understand that the patient has an understanding of what you have taught them. So this is pretty good. But let's see the next one. Verbal explanation. Verbal, how many times do you tell somebody, and if you don't get the teach back method and they don't tell you, they're just like, yeah, I get it. They don't understand all the time. Verbal explanation, not the most effective. So looks like teach back method is the best way because that way it ensures that the patient understands. You know that. Verbal explanation, you're just telling the patient leaves. I don't know if you understood. Video tutorial, was the video done right? Was it catchy? Did it use the terms that the patient understood? I'm not sure. Printed materials, nobody likes to read now. Nobody likes to read. Which aspect of the admission process may take more time when assessing a client with intellectual disability? So, client has intellectual disability. They probably can't convey the information as right. So, performing a physical examination. Performing a physical examination, this is what the nurse sees and hears. And what they feel. These are your senses. It has nothing to do with the patient. I can perform a physical examination to a deaf-mute person. This has nothing to do with their intellectual disability. So, this probably won't affect how long it takes. Obtaining the client's medical history. The client has to tell me their medical history. This can probably take a little bit of time. So I can see where this can happen, where a patient with an intellectual disability probably, takes a little more time remembering their things. So let's move to the next one. Developing a care plan. I can develop a care plan for a disabled or non-disabled person. That doesn't affect me. Shouldn't affect anybody. No nurse. Checking the client's current medications. I can look at that even when they're not there. I can just pull up their chart. So the only one that really will probably take a little bit more time with the patient with intellectual disability is probably obtaining the client's medical history because I have to ask them their questions and I need to hear them. So checking the client's current medications, I can do that without them there. Developing a care plan, I can do that for any type of patient. I don't need them to be disabled or not disabled. Performing a physical examination, I can perform that to a patient in a wheelchair, disabled, not disabled, intellectually disabled, it doesn't matter. I just have to see, hear, feel. So, obtaining the client's medical history in this case with a patient with intellectual disability. What health conditions are commonly seen in foster children in a community outreach program? So, foster children, these are kids that are in the system. They're not living with their biological parents. So, a lot of things usually have to do with like mood and psych things. So, we're going to think about mood and psych with these children just because they've had a rough life. Bipolar disorder. So, this is typically seen with like mania when a patient is can't sleep, and then depression, they'll switch over and get depressed. That could be seen. That can be like mood psych, sleep problems. Definitely, definitely. A kid has been in the is in foster care. That can be something that you can definitely see. Attention deficit hyperactivity disorder. More psych stuff. Definitely, this is something that you typically do see in children. Aggression. Yeah, absolutely. Being in the foster system. I mean, some kids do get upset. Asthma attacks. No, I mean that's not really like a psych issue, not a mood issue. That's just something that how your body responds to the environment. So has nothing to do with you're a foster care or not. Irrational fear of confined spaces, unless they've been like abused in the foster system, then you would see that. But typically, that's not something you see. It's a lot of other mood and psych issues, but this is typically an irrational fear. Unless they were abused and stuck in a closet, then we'd be concerned. So definitely aggression, ADHD, sleep problems, bipolar, irrational fear, unless they were stuck somewhere, asthma attacks. That's seen if you're in foster care or not in foster care. Which healthcare need is a top priority for a nurse caring for a refugee? So, a refugee is a person that's escaping somewhere for maybe like a political, religious reason. They're escaping. They've been through a lot, so they're escaping somewhere. Access to mental health care services, pretty important. I mean, patients been through some things others have not experienced. This is definitely something important. Access to housing. I mean, they are going to get that, but that's not the top priority. I mean, we're talking about healthcare here. So no, access to clean water, absolutely. I mean, it's important, but it's not a top priority. We want to make sure they're mentally well. They're not going to harm themselves. They're not going to hurt others. Access to transportation, absolutely, is something that's very important, but not to the point where it's going to cause hurt or harm to others. None of these have to do with hurting themselves or hurting others. So, access to mental health care service. We want to make sure they're doing okay. Access to housing, access to clean water, access to transportation. Not a top priority. A priority, but not the top. What are the potential health risks associated with residing in a prison environment? When you're in prison, there's a bunch of people in there that could be carrying a lot of diseases. So healthcare access is limited in prison setting. That's not true. There's usually doctors on there. I mean, you've probably seen TV shows like Prison Break where the guy left with the doctor. So it's not limited. People do have doctors there. So no. Living in a prison can increase the likelihood of certain health issues. Well, there are a lot of different patients that go to jail. They probably don't follow up with doctors as they should. They're too busy committing crimes. So this can definitely be seen as a possibility. Residing in a prison is no different than living in a normal residence. I don't think anybody would ever think that. There's a reason why people are in prison. Home is not like prison. I don't think anybody lives in a 6x8 cell. Residing in a prison is similar to living in a dorm or apartment complex. Once again, heck no. You're in jail doing time for a crime that you committed. So no, that is not. Home is not like prison. Let's get that out of here. So living in a prison can increase the likelihood of certain health issues. Yeah, absolutely. What step will the nurse take to help ensure that the client with a chronic illness, we have a client with a chronic illness, follows the prescribed treatment plan? So we have a patient with chronic illnesses and we need to make sure they follow up. So we concentrate one illness at a time? No. If they have chronic illnesses, we don't do one at a time. We need to focus on the whole person. Focus on whole person. So no, absolutely not. We need to focus on everything. Only speaking with one healthcare provider to reduce confusion for the client. No, I mean, if they have chronic illnesses, they probably have specialists. We need to make sure that the entire team is involved, not just one person. Setting up home health care services. I mean, this is definitely something that's reasonable just because they have chronic illnesses. I mean, home health care, they'll come to their house, they'll help them out with following up with their treatment. So let's see what the next one says. Encouraging the client to educate a caregiver on the treatment plan. So we're going to have the patient educate the caregiver? No, absolutely not. Some patients don't even understand what's going on with themselves. They just know that they're sick and they come and seek help. So setting up home health care service is the most important thing when it comes to prescribing a treatment plan for patients with these chronic illnesses. Concentrating one illness at a time, absolutely not. You don't just go into to the emergency room and deal with one thing. They come in and they're with 10 million problems. You have to deal with everything. Only speaking with one healthcare provider to reduce confusion. No, I mean they need specialists if need be for chronic illnesses. Encouraging the client to educate a caregiver. No, we can't have them teaching. Setting up home health care services. Which physical assessment finding, so something that we can see, if noted by a nurse caring for a client in the emergency department, so we're in the ED, with a complaint of fatigue and shortness of breath requires further action. So remember, we're in the emergency department where a patient is tired, complaining shortness of breath. what's concerning if we find if we have a patient like this? A reddish purple mark around the neck. So thinking of bruise, maybe some sort of abuse. This is kind of concerning if a patient presents to the emergency department with something like that, where they choked, where they strangled. So let's move on to the next one, see what else we have. Red eyes. Patient comes in with red eyes. Could mean allergies. Could mean a conjunctivitis, which is just an infection in the eyes. Not really concerning. That can be done even at a primary care office. That can be treated. Dry flaking on the scalp. Start thinking of something like a seborrheic dermatitis. This is like inflammation of the scalp, of the skin, typically caused by a fungus. This can also be treated by a PCP. Not something that needs to be treated emergently. Scaly rash on the elbows and knees. This, we're thinking of maybe something like a psoriasis, like this itchy rash that shows up on the elbows and knees. That can also be treated by the primary care doctor. Nothing that's concerning. What I am concerned about, though, here is the reddish purple mark around the neck. It's around the neck. Somebody tried to kill somebody, perhaps. You got to worry about this, especially when we're talking about in the emergency department. So, scaly rash on the elbows and knees, psoriasis, let the primary care doctor. Nobody's going to die about that. Dry flaking on the scalp. Patient just has some seborrheic dermatitis, some dandruff. You treat that just with an antifungal shampoo. Red eyes, allergy medication or an antibiotic. Nothing that's emergent. But red purplish mark on the neck. Patients coming here with fatigue and shortness of breath. What if they damage the windpipe, the trachea? We got to be concerned. Which of the following is considered the most appropriate form of communication when working with a transgender patient? So, the most appropriate form. Addressing them by their first name only. Probably not the most appropriate. You typically call people by their first and last name. You call a guy Mike, 5 people turn around, so probably not going to be the best. And then at that time, what if they're called Mike, but they want to be addressed as a female? So probably not the most effective when you're working with a transgender person. Utilizing the preferred pronouns as identified by the individual. Transgender patients, you want to consider their preferred pronouns. Referring to them with pronouns corresponding to their biological sex. Remember, with transgender patients, you're dealing with them with their preferred pronouns, not the ones that are corresponding to their biological sex. You don't want to offend them. Making assumptions about their needs and offering suggestions. Never make assumptions in medicine. You do help people's needs and you offer suggestions, but never based on assumptions. So, utilizing their preferred pronouns as identified by the individual. You never want to make assumptions in medicine. You're just going to get yourself in trouble. Referring to them with pronouns corresponding to their biological sex. No, you want to use their preferred pronouns. Addressing them by their first name only. Like we said, you call a person Mike, 5 people turn around. Probably not the most effective way. You might accidentally then start using the wrong pronouns. Always use the preferred pronouns. The nurse is working with an outreach program that provides basic health care to homeless individuals. In case of multiple findings, which one should the nurse prioritize addressing first? Blood pressure reading of 152/74. Remember, blood pressure is chronic. Person's probably been living here for some time. If it was 180/110, then I'd probably be a little bit more concerned. Then you start worrying about organ damage. 152/74 isn't going to be something that I should worry about right now. It's not pressing. So, but poor visual acuity of 20/180 in both eyes. This is poor vision. Blind people have survived in the past. People with poor vision have survived. This isn't really a pressing issue. But just to reiterate, 20/180, what does this mean? This is their vision, this is them, and this is the average person. So the average person at 180 feet can see, like, let's say they see a drawing and they can see it pretty good. That person can see the same drawing at 20 feet. If they go past 20 feet, they can't see it. So if we have the drawing here, the average person, they can see it at 180 feet. This person, the homeless person that we're talking about, they have to be at 20 feet. So they have to be a lot closer to see that. So their vision kind of sucks. So not really a pressing issue. Complaints of pain with numbness and tingling in their feet. Now this has to do with nerves. This is a little concerning because what if there's a spinal cord issue that we're missing? Something's going on with the nerves here. This is a little concerning. So we'll go to the next one and see. High blood sugar level of 208. Remember, blood sugar normally is like 70 to 110 normally. Here we're nearly double, but hyperglycemia or elevated blood sugar is not as concerning as low blood sugar. Low blood sugar, yeah, I'd be scared. But high blood sugar, they've probably lived here sometime, isn't going to kill them anytime soon. If it was some extremely high blood sugar, like in the 400s and up, then I'd be concerned. But it's kind of like the blood pressure. It's chronic, not too concerned. So, complaints of numbness with pain and tingling, complaints of pain with numbness and tingling in their feet. This is something to do with the nerves. What's going on here? This is pressing. High blood sugar is a chronic issue. Not super high where I'm super concerned. Poor visual acuity. People with poor vision have survived. They'll survive another day. Blood pressure reading of 152/74. Blood pressure is a chronic issue. Nothing too concerning.